It gives me great pleasure to address you today at the workshop Good Intern Program 2020, launched by the Society for Health Research and Innovation in collaboration with the Government Medical Officers Association and the Ministry of Health. The critical importance of medical profession and healthcare personnel in our society has been dramatically underscored by the COVID-19 pandemic that is currently raging across the world. I think the importance of this program was mentioned adequately by the previous 4 speakers, and especially winning the confidence of the patient was very important. I started my career in the army, so very often we have to visit the military hospital. So once I went, and it's a known factor among the military officers, there was this dentist actually. So we used to visit regularly, we have to visit regularly. So when we visit and we wait outside the dental office to clean and check our teeth, so that when there are so many doctors, this particular doctor, when he opens the door and puta in the කිව්ව ගමන් අපි ඔක්කොම දුවනවා. මොකද ඒ තරම් එයා ගැන තිබුණු reputation එක අපි ඔක්කොම බයයි. So I think the most important thing is your reputation as a doctor among the patient. So I think it's very important to have start your career with this type of training program. Actually, that Sri Lanka has been largely spared in the COVID pandemic is due to primarily to decisive early action taken by multiple arms of the government and the truly outstanding effort of the health personnel. Doctors, nurses, public health inspectors, technicians, and numerous other staff in our hospitals, laboratories, quarantine centers, and the community level, ably supported by our armed forces, dedicated themselves to stop the spread of this disease. The outset of my address, I take this opportunity to commend, pay tribute to and express my gratitude to all healthcare professionals and others who contributed to Sri Lanka's response to COVID-19 pandemic. The outstanding success Sri Lanka achieved in this endeavor came at a time when even some of the most developed countries in the world were unable to respond adequately to the pandemic. Due to a variety of factors ranging from a delayed response by the governments to the lack of universal health insurance, the unpreparedness of their healthcare institutions, the lack of sufficient testing, to the inadequacy of their management systems, the spread of the virus could not be contained in several developed nations. In many countries, patients who were infected with this virus were turned away from hospitals and left to fend for themselves or were not treated with adequate care. This resulted in community transmission of the disease, ultimately resulting in soaring rate of infection and death in these countries. In this context, while I express my profound sympathy for the plight of those nations that have borne the brunt of the COVID-19 pandemic, I'm also proud to say that Sri Lanka, despite still being a developing country, managed to face this situation very successfully because of our free healthcare system. Not even a single patient suspected to being infected with COVID-19 was turned away from our healthcare system. Each and every patient was treated at our government hospitals at government's expense, and 2,906 out of 3,114 confirmed cases have been successfully cured to date, with only 12 fatalities thus far. The preparedness of our public health infrastructure, the hard work of our public health inspectors, combined with other arms of the government, including the police, intelligence services, and armed forces, ensured that proper contact tracing and isolation took place, thereby preventing community transmission of the virus in Sri Lanka. The robust testing mechanisms we were able to set up in a short time supported these efforts by identifying asymptomatic patients and ensuring their isolation and proper care. We have also repatriated thousands of our citizens from countries where the virus is spreading. To be precise, as of today, 31,664 from 105 countries were repatriated, and returnees also have been housed at quarantine centers around the island, where they are looked after to a very high standard by our armed forces personnel. Most of these centers are managed entirely at the expense of the government. These are all remarkable achievements by any yardstick. These achievements are why Sri Lanka's success in dealing with the COVID-19 pandemic has been justly commended by international institutions, including the World Health Organization and UNICEF, as well as many foreign nations, international commentators, and individuals. The effectiveness of Sri Lanka management of the COVID-19 pandemic signifies the strength of our public health care system. In this context, I must confess that I find it puzzling as to why so many of our citizens seek health care externally. On many occasions, even grants provided through the President's Fund and other welfare schemes in the government are used to cover hospitalization in private hospitals. While there is certainly a need to further strengthen the state healthcare system, I believe it is time that we encourage greater use of the facilities we have within this system. Some innovative thinking towards absorbing the state-generated funds into the public health care system will ultimately benefit the citizens. Another important lesson emerging from the COVID-19 pandemic has been the importance of maintaining a centralized healthcare system. Although the administration of most of Sri Lanka's state-run hospitals are vested with the provincial councils, fortunately there were enough hospitals nationwide under the management of the health ministry that could be utilized without difficulty during the height of pandemic. Had we been in a situation where healthcare was a subject completely devolved to the provincial councils, the efficacy of Sri Lanka's response to the pandemic may have been quite different. Our recent experience reinforces the importance of maintaining responsibility for certain functions with the central government. As you know, education is another vital area of public life that can be similarly described. Moving forward, it is important for us as a nation to truly understand the challenges and opportunities that face us and to design our response to them appropriately. The mandate given to the government by the people at the parliamentary election just a month ago makes it very clear that the Sri Lankan public is hungry for development and tired of excuses. One of the core pillars of development is the maintenance of a healthy population. Achieving certain public health goals remains a core responsibility of the government. I am determined to work towards creating a healthy nation during my tenure as President of this country. My recent visit to every corner of Sri Lanka exposed me in depth to many real issues that our fellow citizens face. These grassroots level issues are wide-ranging, from lack of drinking water to lack of education to lack of proper healthcare facilities. There are many rural areas of the country where people have to travel long distances in order to consult with doctors for their various ailments. Unfortunately, the population density in these areas could be too low to justify the building of hospitals or other healthcare infrastructure that can adequately cater to the needs of these people, particularly considering Sri Lanka's present economic position. However, there may be simpler solutions to these problems that can be adopted with a more proactive, practical mindset. One of the more successful healthcare initiatives in the history of Sri Lanka, and another that has been commended internationally, is the public health midwife program. These hard-working healthcare service providers have delivered community-level maternal and child health care throughout Sri Lanka for decades. They have been the frontline health workers delivering care and advice to women and children at the household level in many rural communities. Similarly, it may now be opportune for us to introduce a new concept, that of the public health nurses, who could provide basic health care services to those in very rural communities that lack access to other healthcare infrastructure. Adequately trained and qualified nurses may be able to help diagnose and treat simple ailments, and given individuals requiring higher level care the advice required to seek medical attention. They could perhaps even refer patients to doctors in the region as and when required. This sort of initiative may contribute significantly to improving access to health care within rural communities and thereby contribute towards better health care in the nation at large. Recently I visited Lanka Gama, that's the village in Gaul district, bordering Singharaja forest. In fact, when I went there, I was surprised to see a doctor based there. There was a primary care, healthcare unit that is called, I think. There was this doctor who was stationed there. Of course, he had many issues. He didn't have a nurse there. At the same time, why I went there was to improve the road access to Lankagama. But he was saying that his difficulties were mainly the access to better medical, give a patient a better medical care. So I think today there are primary health care units in the rural areas, but I think we need more doctors in these rural areas. Parallel to this initiative, we could also revive the many rural dispensaries and through them provide basic and simple solutions to citizens' health issues. This community level health infrastructure would immensely contribute towards creating a healthy nation. At this point, I would in particular like to address those of you who are young doctors who have recently graduated from our universities and have qualified as medical interns and are taking part in the good intern program. The medical profession is one of the noblest calling that one can aspire to. Even as young doctors, you are responsible for the lives of other people. Sometimes your diagnosis of a patient's illness could be the decisive factor in his or her life. The decisions you make could be the difference between one's life and death. This is certainly not a responsibility that can be taken lightly. If anything, the difficulties associated with reaching your status from the outstanding exam results you must produce to the many years of education and training that you must undergo before qualifying for your MBBS signal how serious your role is in society and what a tremendous honor it is to be a provider of health care. In this context, I wish to congratulate all of you on your having been included for the Good Intern program, which aims to improve the service provisions of the health sector by increasing the understanding young doctors have of good medical practice and the grave responsibility towards their fellow beings. In the words of the Buddha, Arogya Paramalabha, health is the ultimate profit. By dedicating yourself to the highest standards of healthcare provision that can be achieved, you will be in a position to contribute immensely to the well-being of your fellow men and women. In closing, I take this opportunity to wish each one of you every success for the future and hope that you will contribute to your utmost to Sri Lanka as outstanding young healthcare professionals. Thank you very much.